neural pain is quite intense, and also obviously any sort of contractions of muscle can bring on pain then in the nerves if there's a nervous problem. There can always also be brain gut dysfunction, which is when there's just a miscommunication really between the brain and the gastrointestinal system. That could be for a number of reasons, like brain issues even. Irritable bowel syndrome is an example of this. So often patients have a lot of discomfort, pain, and it doesn't always show any results on tests, but it can be very difficult for the patient because the symptoms can be extremely painful, and they're also quite debilitating depending on how bad the symptoms become. Then the other type of disorder you get are structural disorders, and those in which the bowel does look abnormal and also isn't working properly. So abnormal functions of the bowel would tend to be things like diarrhea, constipation, as well as all of the pains and stuff we were just describing. So sometimes it's possible to remove structural abnormalities depending on what's wrong. We'll have a look at a couple in a minute, and you can see, well, that there's just lots of different types, and it's not always possible. It is possible to remove parts of sections of the bowel because it's so long. You can remove parts of the small intestine fairly easily, fairly routinely, parts of the colon as well. So it is possible to remove parts of it without too much difficulty. Common examples of structural disorders include hemorrhoids, diverticulitis or diverticular disease, colon polyps, colon cancer, and all sorts of inflammatory and bowel diseases.